So today I'm giving a speech to my family and some family friends today. So you have my sister, my mom, Miss Victoria, Miss Mallory, and my dad again. So I will give this to my sister.
Yep, good.
All right. So you got me, Jill?
Yep.
Okay. So today's speech is going to be on MS. So I chose to do MS because I have currently 2 family members dealing with MS. My wife, 4 years dealing with MS, and my mother-in-law has been dealing with it for 15 years. They have what they call relapsing remitting MS, which is they have it and then they'll remit into a stage of no signs or symptoms of MS. And it can come and go as it pleases. Certain things trigger, and we'll go into detail later on. So MS is an autoimmune deficiency that the disease attacks the myelin that protects the nerves of your body. And as they attack, they can cause symptoms and cause interference with communications between the body's brain, spinal cord, and other body parts of the body. It usually takes place between the ages of 20 to 40, but it can be sooner and it can be later. But those are about the average time frames that a person will be diagnosed with MS. MS is a there are 4 different types of MS, and that's the relapsing remitting version, which of course my wife and my mother-in-law have. There's a secondary progressing, a primary progressing, and a progressive relapse. And I won't go into detail about those. MS is it comes from a family. You can either have a family history of MS and you can get it, or it can be you can get it if you're in an area where it's more common. A doctor can diagnose MS by taking an MRI of the brain and the spine and doing blood work, and if there's any visual acuity issues going on. A flare-up or an exacerbation or an attack can happen at any time. Like I stated earlier, they can just randomly happen. Certain things cause it, such as heat, stress,
Wesley.
And fever. I'm sorry, fever. Fever can high-grade fever can cause an MS episode to happen. So relapsing remitting is diagnosed in about 85% of individuals that first are diagnosed with MS, and then it can progressively get worse into the other 3 types of MS as a person goes along, depending on if they're getting treatment or not. So there's 10 different types of medication treatments that are out there. There's 5 injectable treatments where a person injects themselves with a certain medication, and they have to take it for the rest of their lives, inject themselves for the rest of their lives. There's 3 oral medications that are pretty new to the system, so they're not. Those are not always as effective with certain patients, so a doctor has to tell you if you're a candidate for those. And then there's two infusion medications. My wife currently takes an infusion medication every 28 days to keep her MS down. Some of the symptoms of MS for a particular person can be fatigue, vision problems, numbness, spastic back and neck issues, or stiffness of the back or neck. That can be some of the issues. Bowel and bladder problems also. Currently there's no cure for it, MS, but they are still fighting the fight to get it cured. You can have some of the things that you can do to help minimize MS also is rehab, especially for those that are having stability problems and walking. You can do some rehab to get those issues help with those. MS affects more men than women in life. Not, so, in conclusion, again, the reason why I wanted to talk about this is because my mother-in-law and my wife have been fighting this disease for a significant amount of time. My wife's MS started shortly after my son was born, about 4 years ago, and it was just a random, she just started having some visual problems and very tired, and one thing led after another, and she went and saw her doctor, and within 2 days she was diagnosed with MS. So she's been fighting the fight for a good time. So I appreciate your coming and listening to my speech about MS, and thank you very much.
Wow.
Okay.
Stop it.
And
I'm always going to